I will do it like this. So welcome everyone to this course on Diagnostic Biliopancreatic EUS, which is really focused on the trainee. So what we want to do in this course is to give an overview on the different aspects of basic diagnostic biliopancreatic EUS that will be helpful during your training, to start your training or to conduct your training. The key objectives of this session are how to apply a systematic approach while performing biliopancreatic EUS. We will provide tips and tricks for training in biliopancreatic EUS, and we will also end today with a presentation on how to find and describe biliopancreatic lesions using EUS, all starting from the basics. This is our faculty. So I'm Peter Hendricks. I'm working at here in the University Hospital of Ghent as an interventional endoscopist focused on HPB. We have Professor Dr. Helena de Grote, who will be performing the first case and will give the third lecture. She is working in the University Hospitals of Brussels in Belgium. Remotely, we have Dr. Raymond McCrudden. He is working at the Nuffield Healthy Bournemouth Hospital in the UK. And then we have Dr. Enrico Palmieri, who is also working in the University Hospital of Ghent. And in fact, it are his last 2 weeks. He will be working at the University of Padua, starting from June. This is the program of today. As you see, we have 3 lectures and 3 cases, and we have some room for discussion. With this, I would like to start with the first presentation, which is the EUS evaluation of the pancreaticobiliary tract, a systematic approach. And the key objectives of this lecture are to understand the importance of a systematic approach in the EUS evaluation of the pancreaticobiliary tract, because I think that it's really important that from the start of your training, you use a systematic approach. Your trainer will demonstrate to you how to do this. Some of the trainers will start from the duodenum, some of the trainers will start from the stomach. In fact, it does not really matter as long as you always apply this systematic approach. It's important that you visualize the anatomical landmarks, because they are crucial if you want to stay in the right plane and you want to do a complete examination and to be sure that you've seen everything. Station 1, so I like to start from the duodenum, and station 1 is in fact right after the papilla. So what we do, we visualize the papilla, and then we go a little bit further with our endoscope. We do upwards flexion, and the landmark here is the aorta, because you want to see the aorta, because you know that next to the aorta you can evaluate a difficult region of the pancreas, being the uncinate process. The uncinate process can be seen from the duodenum or from the stomach, but sometimes a lesion in the uncinate process is only seen from this station 1 right after the papilla. I show you in clinical practice how it goes. So we are now with our therapeutic EUS scope in the duodenum, and we are looking for the papilla. So you see the papilla here at the 12 o'clock position. So once you see this, you aspirate all the air and you will go a little bit deeper with your endoscope. And then you do an upwards flexion so that the transducer is well in contact with the duodenal mucosa. So what you see here is indeed the aorta. So you have to look for this aorta, and next to the aorta, you will find a region of the pancreas, which is the uncinate process. And you really have to look for the aorta to be sure that you're indeed visualizing the pancreatic parenchyma over there. The second station is at the level of the papilla. The landmark here is, of course, endoscopically the papilla, but also the stack sign. And I will show you in the video what is meant with the stack sign. The purpose of this station is the evaluation of the papilla itself and the pre-ampullar bile duct and pancreatic ducts. You can also evaluate a part of the pancreatic head parenchyma. Sometimes you can see a lot from this station, but the pancreatic head parenchyma is also seen from the first part of the duodenum. So this is how it goes in clinical practice. So again, we will visualize the papilla. I think in the beginning, it's really good that you go for endoscopic visualization first, because in this way, you know that you're looking at the right sides. Maybe over time, it's not needed anymore. But in the beginning, I would really recommend to do it in this way. So what we do now, so we are now with our EUS scope in front of the papilla, and we gonna introduce the transducer is just put at the level of the papilla. We will look now at the upper right part of the screen, and we make small, tiny clockwise, anti-clockwise turns while we are slightly withdrawing the endoscope until we see channels appearing. And you see already that there is one channel appearing here. The first channel that appears is the pancreatic ducts. So this is the pancreatic ducts. You can put Doppler flow in it if you're in doubt. And if you withdraw a little bit more, and you keep on going with clockwise, anti-clockwise turn, you will see that there is a second channel appearing here. And the second channel here is the common bile ducts. So the common bile duct is the channel that is closer to the transducer. Common bile duct here, pancreatic duct here. If you see both together, this is called the stack side.